Okay, so let's bring in Dr. Susie Hoda, Division Head of Infectious Diseases, University Health Network. Forgive me if this is a very naive question, but what is considered fully vaccinated for measles?
To get the maximum protection, you need to have 2 doses of the vaccine. And then about 98+% of people will be protected against measles.
So when I think about it, most people I know, I mean, were vaccinated as children. Good luck finding those vaccination cards, though. So how do you actually know if you're fully vaccinated?
I mean, the best case is you do have a record of your vaccinations, but if not, you can ask a parent or an older sibling if they recall, or you could try to trace it back from your doctor's office. But really, there's a simple blood test that can be done that will tell you that you're immune to measles, and it's very accessible.
Is it something you have to pay for?
It is not something that you necessarily have to pay for, but you should probably check in your jurisdiction.
And if you're not, if you discover that you aren't fully vaccinated, are you getting 1 shot, 2 shots? What do you have to do?
So ideally you would get 2 shots, but I didn't want to leave you with the impression that 1 shot is not effective at all. 85 to 90% of people will actually be immune after 1 immunization. So, you know, it is still of value, but the 2 shots, like I said, will give you almost 100% coverage.
But we have a situation where spring break is like roaring down the tracks at everybody. There's not much time left, and yet
Yes.
the warnings are going out that, you know, be careful if you're traveling, spring break. Is there enough time at this point for people to be sufficiently vaccinated if they aren't already?
Well, it does take 10 to 14 days to get your full immunity developed, but even partial immunity is going to help you. And given just how high the stakes are, I would recommend that people go ahead and get immunized if they are not immune already. And even if you're not traveling, I'd say get immunized, because a lot of people around you are going to be returning from travel, potentially from places where there's lots of measles activity. And so it's really an opportunity for everyone.
So if you are coming back from vacation and you're not feeling great and your mind is anxious, thinking, oh, what if this is measles? What are you looking for and what should you do?
So first of all, you should be aware of what the symptoms are, and usually you have some pretty vague symptoms before you actually develop that characteristic rash that people think of with measles, you know, starting with the face and then descending down through the rest of the body. If you think you have measles, it is important to get medical attention, and we do track these cases. It's very important from that perspective too, but you should let the clinic know or the emergency department know that you're coming, because that way they can ensure that you're properly isolated and other vulnerable people around you are not going to get exposed.
So I remember back in 2000, for example, when in North America, the story we were reporting was that it's over. You know, measles has been eradicated. Another one wiped off our concern list. How are we back here?
We're back here because immunization rates have dropped. And we don't have, you know, great real-time data on this, but we do have some survey data from 2021 that shows that kids, you know, around the age of 2, about 92% of people had gotten 1 dose. But when it comes to the second dose, it had dropped below 80%. And that was data from years ago now. So I think that, you know, we do need to have very high immunization rates, 95% of the population immunized in order to get herd immunity, which means it can protect those around them who may not be able to mount an immune response or who are especially vulnerable. And we just haven't been able to achieve that.
Okay, ways to go. Dr. Hoda, thank you.
Thank you.
Okay, so let's look at this more closely. How did we get from a disease that was gone from our lives in this country to this reality? What happened? Maybe these survey results from the Angus Reid Institute can help a bit. For parents of minor children, 17% say they are really against vaccinating their kids. That is 4 times the response from just 5 years ago. There's also been a drop in support for mandatory vaccinations in schools from 70% to 55%. So let's dig deeper into those shifting attitudes. Tim Caulfield is a professor of health and science policy at the University of Alberta. One of your specialties, Tim, is misinformation and disinformation. So I'm really curious, would we be seeing this kind of outbreak right now if not for the COVID-19 pandemic, the anxiety around it, the anxiety some have about the vaccine?
No, I really don't think so. Look, lots is going on here, right? There is understandable vaccination fatigue, just because we've been talking about vaccines so much over the last couple of years. There is a complacency, I think, you know, a lack of understanding about how serious diseases like measles can be. But for sure, I think we're seeing spillover around the controversy and the misinformation from the COVID vaccine. And also, I think that polarization and the degree to which this has become, unfortunately, about ideology. I think that's all of that flowed from from COVID, and now we're seeing it have an impact on diseases like measles.
I suppose in a way, though, it's actually not that new. Like most people in Canada are vaccinated, I guess in the neighborhood of 90%, but not true everywhere. I think about Ukraine, because even before COVID, even before the war, we were talking about doing stories because measles was endemic there. And a real fear about vaccine harm seemed to play a huge role even then.
In places like Ukraine, there's been some really interesting research around this. What drove that hesitancy? So there was sort of a heightened distrust of the healthcare system, inefficiency in how the vaccines were delivered. For sure, that played a role. But yes, misinformation and kind of the embrace of conspiracy theories led to that hesitancy. And even, the big one, that idea that a complete lie, a myth that vaccination is tied to things like autism, consistently debunked, but it lived on in these communities and did real harm. And we can learn from that.
We talk about the health concerns of clusters like this, but I find it kind of interesting that over the years, people have looked at global measles clusters as indicators of something else happening in these societies. And what story do those clusters tell you about a place?
When these topics become about ideology and they become about politics and they become about kind of the broader embrace of conspiracies and misinformation. And I think we can really learn from that, because one of my greatest fears is that we're going to see that kind of politicization in Canada, or at least even an increase in politicization around things like vaccination. This needs to be about the science, right? It really does need to be about the science and not about making this an ideological platform, as we're seeing in some jurisdictions in North America already. And of course, I'm thinking about Florida. More science, less politics, please.
Not everyone who is saying no to a vaccine is a conspiracy theorist. I mean, some people are genuinely afraid. How do you get ahead of that?
We do need to counter the misinformation. We need to debunk, and as I said, do that constructively. We need to pre-bunk. We need to educate people about what the misinformation around vaccines might look like so they know it when they see it. We need to listen. I think that is so important. Empathize and tailor the message to individuals and communities in a respectful way that really addresses their concerns.
All right, Timothy Caulfield, thank you as always.
Thank you.